Hello, everyone. Good afternoon, everyone. Thank you for joining joining RESNA's webinar today, titled Wheelchair Skills and Assessments in Training, an Evidence-Based Approach. My name is Mariah, and I am RESNA's Membership and Operations Associate. Before introducing today's presenter, I'm going to review a few logistical items. Please keep in mind, to ask a question, feel free to put the question in the chat and I can answer them at the end of the presentation. But feel free to ask any questions and unmute yourself, then turn on your camera and feel free to ask any. Also, this webinar is going to be recorded and will be linked to the event in RESNA Learn within the next 48 hours. After the conclusion of the webinar, you'll be able to complete a brief evaluation survey along with a post-learning assessment. Both are located within RESNA Learn. Upon completion of the survey and the assessment, you will be presented with a certificate of attendance valid for 0.1 IASET accredited CEUs. We appreciate your input. I'd now like to turn things over to today's presenter, Lee Kirby, to begin his presentation.
Thank you, Mariah. We'll just skip through these couple of slides here that you're just dealt with and about the CEU credits. And thank you for the introduction. Welcome. It's a real pleasure to address RESNA members and attendees. RESNA has been part of my life for decades now, and I really feel it a privilege to speak to you today about something I'm very passionate about, which is assessment and training of wheelchair skills. So as far as setting the stage from my perspective, I'd like to acknowledge the contributions of our wheelchair research team and many funding bodies, which I'm not going to go into at any length, or not at all. They're available online. I have no conflict of interest to declare. Target audience, as I mentioned, is RESNA members. We do have a website, which we'll come back to just a little farther into the presentation, the Wheelchair Skills Program website. There's a handout of this slide deck, 6 slides per page that you'll have available to you. I've sent that along to Mariah already, and as she mentioned, there's a recording. As far as any questions, feel free to post them orally or in the chat box as we go along. Or if you're viewing this after the fact, not as a live presentation, or even if you are and would like to ask a question that comes up later, then just feel free to contact me at that email address. So my objectives for this session are as shown here. I'd like at the end of it that you could describe, at least in an overview way, the WHO wheelchair service delivery process, to describe the components of the Wheelchair Skills Program and the extent of research evidence. Don't worry, I'm not going to go into it all in detail, but I will summarize it. And thirdly, how you might implement the Wheelchair Skills Program protocols in your own settings. So let's start with the WHO. Well, we all know wheelchairs have many benefits. So you wouldn't probably be tuning into this if you weren't already convinced of that. And those benefits are listed on the left, but wheelchairs are not without their problems, as shown on the right. As a means of trying to tip the balance in favor of the benefits and away from the problems, there are 3 broad ways that I can think of, and they're listed below here. Better accessibility, of course, is always a great help. Better wheelchair design, and there's quite a lot can be done in that from that perspective. But today we're going to focus really just on the better wheelchair service delivery. The WHO back in 2008 came out with these pivotal guidelines. And as you can read the title there, it's the guidelines on the provision of manual wheelchairs in less resource settings. Well, it soon became apparent as people around the world started using these guidelines that it wasn't just for manual wheelchairs, and it wasn't just in less resource settings. And so over a number of years, although the variety of training packages have come out based on those guidelines, back in 2023, in summer of 2023, they have updated their wheelchair provision guidelines. And those are freely available online. The website is shown at the bottom. You just go on there and you can download the whole thing if you wish to do so. Just to summarize briefly, the 4 steps, there were 8 steps in the original uh, process that recommended by WHO, but they boiled that down to 4, as shown here. Select the appropriate wheelchair, fit the person to that chair, train them in its use and its care and maintenance, and follow up. The training piece is what will be most important here. But unlike the 2008 model guidelines, the guidelines now are relevant for all countries, not just less resourced ones, all wheelchair users and their caregivers, and all types of wheelchairs, power chairs, manual chairs, scooters. And it's not just new users, even experienced long-term users. So they've very much broadened the scope of the WHO guidelines. That's all I'm going to say about that for now. I'll come back to it in the evidence section a little later. So now let's talk about the components of the wheelchair skills program. And I'm going to assume that you are not familiar with it, but if you are, then it's just a quick review for you. We have a website shown here that the first inkling of the program was in 1996. So we've been moving on and revising and trying to update over that period of time. And there's this menu on the left of the website here. We're going to go through some of those menu items. We're not the first program to talk about wheelchair skills training, far from it. It's in many textbooks and handbooks. What's different about the wheelchair skills program that we like to think and I think is true is to really focus on evidence. If there's evidence that there's a better way of doing something, we include that. We don't just focus on the training, but also the assessment, because that's an important part of the training. We look at the wheelchair users and their caregivers, manual chairs, power chairs, and scooters. The process and sequencing has sort of evolved over time. And so the order in which one trains skills can have the later skills build on the earlier ones. So I think that's quite a nice feature of the program. We update it often, as most recently, August 13th, 2024. Usually every summer we do it so academics will have the newest version available when they start up their courses in the fall. And they're often just tweaks based on new evidence or new experience with using it. We're currently on version 5.4.2 as of August just passed. And finally, it's free. You don't have to pay anything. It's open source. Use it as you wish. We love that. So let's go into some other menu items here. The skills manual and forms. The manual itself is a little overlong. I apologize to say, 338 pages most recently. But there's a lot of detail in there about the assessment and training in general, but also about specific skills. There's a boiled down version just below that for caregivers, and it's aimed to be given to caregivers. We'll come back to the forms in a minute. So if we move down to the forms, we're just going to use the manual wheelchair as our example here today, because we're pushed for time a little bit. But this is what the page 1 of the wheelchair skills test would look like. As you can see in this column, the individual skills are listed. There's 30 of them for manual wheelchairs. And for each of them, you have an opportunity to grade it on capacity. Capacity being how you perform in a standardized setting using the International Classification of Function and the definition of that. So the scoring from 0 to 3, I'm going to spend just a second on that. Basically, if you carry out the skill in a highly proficient and safe manner, you would get a 3. A basic pass would be if you can do it independently and safely, but there's some room for improvement there. A partial pass would be if you could do part of it, let's say getting through a door in one direction, but can't come back in the other direction. And a fail would be if you're unsafe or you can't complete even half of the skill. There is an opportunity to put an NP for no part. So for instance, if a chair doesn't fold, then you wouldn't be penalized for not being able to fold it. And if there's a testing error, that we just score that as a TE. So the comments section in that form, over here in the far right column, are probably the most important part of the wheelchair skills test. And I'll show a couple of 3 examples of that. So in this example, this gentleman was admitted to our rehab center with a left above knee amputation, and we eventually got around to watching him roll his wheelchair, which you'll see here. And we did not know before we watched him do this that he had Parkinsonism, but it's very clear within 5 seconds, if you've ever seen Parkinsonism, that he's basically doing the walking with small steps, but instead of walking, he's rolling in that way. So we canceled the artificial limb. We got him in a power chair instead of a manual chair, got him on anti-Parkinson medications, all from just the advantage of looking at somebody do something. We wouldn't fail to do a gait assessment of somebody who is walking, and we shouldn't fail to look at how somebody rolls their wheelchair. Those comments can also be helpful in identifying wheelchair problems. So in this example, this gentleman's rear anti-tip devices are too low. And so you'll see when he kind of gets to the bottom of the ramp that he gets hung up. So he's just suspended between his rear wheels and between his anti-tip devices and his casters. The rear wheels are just free to spin. He can hitch himself off there. You can see when he turns around, when he tries to back up against even a small level change, that the anti-tipper prevented him from doing that. So there's another good example of, during a wheelchair skills test, you would identify that as something that needed to be dealt with. Now, in terms of the whole wheelchair skills test, showing all of these skills involved, if you go down to the bottom of the website page, there's a link there to the Wheelchair Skills Program YouTube channel shown here. As currently there are 819 videos on there, and we've got over 2,000 subscribers. But there are individual skills, and there are complete wheelchair skills tests there as examples. So I encourage you to have a look at those. It'll show you what it is we're talking about. And the forms, the scoring for the examples that be shown as well. So if we go back to the website and go down in the forms to the WSTQ, which is the questionnaire version of the wheelchair skills test, it's got more columns. So instead of same list of skills, 1 to 30, instead of capacity, which is the ability to do the skill in a standardized environment, this is performance, the ability to do the skill in your own environment. Again, the WHO ICF definition of that. So similar, but not identical to the capacity. But also there's an opportunity to score for confidence. You may be able to perform it, but you're not very confident. And there's also an opportunity for frequency. I'll just show you briefly what page 2 it looks like. So performance, could you do this skill today in your own setting? Very well, not well, yes with help, and so forth. Confidence, how confident that you could do the skill safely and consistently in your own setting? Very somewhat unconfident, very unconfident. And frequency, how often to do this skill in your own setting? Always when I need or want to, sometimes when I need or want to, rarely when I need or want to, never or less often than once a year. So you don't have to complete all of these sets of questions. You could just, for instance, focus on the performance criterion or the confidence one, or a couple of those. And there's also an opportunity there to ask the person, is this a skill that you'd be interested in receiving training on? So for both the wheelchair skills test, capacity, and the wheelchair skills test questionnaire, performance, confidence, and frequency, you can, in addition to the individual scoring, you can calculate a total score just by total score divided by what's possible and times 100%. And that can be helpful in a research context in particular. Now, if you go back to the website and go down to the bottom of this same page and click on this link, you'll go to an online app. The opening page looks like this, and it just allows you, if you want to enter your data directly into the app and then have it generate a report for you. Again, it can be useful for research or just for report generation. Now, I mentioned there were 3 types of comments, looking at diagnosis, looking at wheelchair problems, but also identifying things that might be helped by training. This young woman with meningomyelocele was having some difficulties getting over a soft surface, in this case gravel, as you'll see here. I'll let you watch it for a minute or two, or a few seconds. So she, as you can see, he manages, she eventually gets over the gravel, so she would be safe. She would be effective because she had gotten there. But she would get a score of 2 because there's room for improvement. And the room for improvement here is that she leans forward, which is a natural reaction when encountering resistance like this, but that puts more weight on her casters and then they tend to sink. They have higher rolling resistance because of the smaller wheel diameter. And so the training tip for her would be to bring her trunk back a little bit to unweight the casters with each push. And that's what we did, and she did improve on that. So that leads us, that's the segue into the other part of the wheelchair skills program. We talked about the wheelchair skills test, that's questionnaire version. The other part of it is the training program, the WSTP. And it consists of 2 components, the process, how to teach, and the content, what to teach. That's what makes up the WSTP. So first for the process, this is all from the motor learning literature. It's nothing you would not be familiar with if you ever played a sport or a musical instrument. They're the sorts of things you do when learning or teaching someone. So here's an example of a, I'll show you the example first and then tell you which motor skills principles are being illustrated. So this is for the skill of getting up a curb, and it's a 10-centimeter high one. Just let me go back a bit so I can forward so you see that 10 centimeters high, and she's sort of building her way up to a 15-centimeter high, which is the high curb, which we usually find out in the environment. So that's one example. That would be simplification, mastering a lower level skill before attacking a big one. Another principle is segmentation. So there's 3 components to getting up a curb. There's the approach, popping the wheelie, or popping the casters up onto the curb, and then leaning forward with your trunk to get the rear wheels up. So we've segmented this. She's just practicing the popping, and she's working on just getting the height of that right. The next principle is augmented feedback. So in this case, she's using a mirror. Instead of looking forward to see where her casters are, she's able to see where they are by looking in the mirror. So those are 3 or 4 motor learning principles, none of which would be unfamiliar to you. Now the content, there's less written in the literature about how to do each of the skills. There's more on some than on others. So here's an example of a training tip for coming down the stairs in the wheelie position, which is quite an acceptable thing to do as long as the horizontal part of the stair is long enough. If it's not long enough, you can't do this. But you'll see what he does. I'll describe it as he goes. He does a wheelie, drops down just as he would if he was coming down a curb, and he leans back to get himself squared up again before moving his hands back. Just repeats that over and over again. And unlike coming down a curb where you would land the casters immediately after the rear wheels land, when you're coming downstairs, the casters have nowhere to land, so that you have to have this leaning back on the upright part of the stair to do so. That's an example of training tips that if you were teaching that skill. An example of some of the evidence related to that in that particular case, that was just a video we took when we were in Kathmandu, Nepal, doing some peer training there. And so that's just anecdotal evidence there, but there is research evidence on various skills as well. So this is an example of a fairly recent such paper in which we looked at getting over a soft surface and identified that for a caregiver getting somebody over a soft surface, that is much easier to pull them backwards than it is to push them forwards. When you're pulling backwards, as you pull on the push handles, or the pull handles, that tends to cause the casters to lift off the surface slightly, whereas if you're pushing forward on the push handles to go forward, that the mechanics are such that it pushes down on the casters into the soft surface. So that's just an example of a type of study we've done on that. Now, what about impact of, we're getting into evidence here, so let's talk about that a bit. So if you go to that that page, sorry, this one down here, impact and publications, we've set up on that a couple of PubMed searches. So the healthcare librarian has set them up for us. We'll talk about the two separately. This first one has to do with wheelchair skills testing. So it's either a paper that is about the wheelchair skills test or the questionnaire version, or a paper that has used those as an outcome measure in a study. And so as of, actually it says at the bottom, September 12th, but I checked it earlier today and that number is still the same, 126 peer-reviewed papers about that. Now the next one down here is again a dynamic link, a PubMed search about the wheelchair skills training program. And as of earlier today, the number of papers was 82. That includes 16 randomized controlled trials and 2 meta-analyses. So here's an example of a paper that just came out last week, September 11th, from Poland, and it's they cited our work 5 different times in this paper. That's it's a cohort study, not an RCT, but they have fairly good sample size, 122 people. They found pretty dramatic improvements in the wheelchair skills test capacity, for instance, and also in confidence. So that's an example of a paper that uses the outcome measure and has done training as well. Okay, how are we doing? So in terms of the level of evidence, up until not so very long ago, the randomized controlled trial is considered to be sort of the top of the heap. Not that these other types of studies aren't also important, but that was felt to be sort of the gold standard for the safety and effectiveness of an intervention such as wheelchair skills training. But as you know, more recently, systematic reviews and, if possible, meta-analyses have supplanted that. And there have been 4 systematic reviews so far. I'm not going to talk about the first one because it was a relatively early one in 2017 based on 10 randomized controlled trials. I'm going to show you a little bit about the second one, which is on 13 RCTs. So we'll just talk about that briefly now. So yes, you're probably familiar with, here are the 13 trials that we were looking at, and here's the forest plot. And there's some variability in terms of the amount of effectiveness, but overall, the total effectiveness is about 20% better than controls as far as relative to baseline improvements. So it's a moderate size improvement in the overall capacity scores. Even smaller skills can be, or smaller gains can be clinically significant, if not statistically so. So for instance, someone who wasn't able to get out and a child not able to get out and play with their friends because they weren't independent in, let's say, going up an incline. So if they went from not being able to do that to being able to even just go from a 0 to a 2 on the WST for that single skill, that really only represents a couple of percentages on the total WST, but that ability would allow them to do some things that they wouldn't otherwise be able to do. So we're quite happy to stick with the overall value of 20%. But important gains can be found at an earlier stage. Now, the second one I'm going to talk to you about here is the one that went into these most recent wheelchair provision guidelines. They didn't do this for the 2008 guidelines, but we harangued them enough during the review process that they really should be basing the guidelines on available evidence. And so they contracted out with an Australian university to do a very thorough systematic review on all of the steps that go into wheelchair provision. So their recommendations are based on that. And so for training from the WHO, you can see there's strong evidence in terms of skills to use a wheelchair, use of the components, strong evidence, guiding others, in other words, caregivers, strong recommendation. Wheelchair maintenance and repair is not quite so much, but still considered to be very important. We were happy enough that during these latest wheelchair provision guidelines that as an example of training, they single our program out for a shout out. We were very happy to get that endorsement from them. And finally, this paper by Siegel et al. Just came out last month in August. I think it's just available online so far. It's in the supplement, and they did they didn't confine themselves to RCTs, but looked at relationship between wheelchair skills performance and training, excuse me, and participation. So not just improvement in capacity or performance, and then improved participation, which is really a step up the ladder in terms of outcomes. And they had 25 papers, and they found a very good relationship with participation. So on the basis of these systematic reviews and in some cases meta-analyses, it looks as though there is some positive effect. Now, in addition to the levels of evidence pyramid that I showed a moment ago, there's also the Kirkpatrick levels of evidence, looking at satisfaction. Do people like getting training? Yes, it's an enjoyable thing to get. Is there a positive effect? Yes, we've improved people's capacity and performance. Do we change their behavior out in the real world? Don't have very good evidence of that. And what sort of an impact might this be having on a broader scope? That's a tougher hill to climb for sure. Well, we like to think of the wheelchair skills program as one that is low tech, so it doesn't cost a lot to run it, but is high in impact over here. That's the ideal for an intervention. As evidence of the low tech aspect, here's a map of some places in less resource settings as well as highly resource settings where we've done an in-person training on how to do the assessments and training. Most recently in Ukraine, one of our team members has spent, I think she's just finished her third trip there for 1 to 2 months, setting up rehab programs and teaching people how to train wheelchair skills. Also, in terms of impact, sort of indirect evidence of impact, the metrics of our online presence. So that the website that I've been showing you there as of April 1st of this year, there were almost 200,000 users from 200 countries. So that's nice to hear. And we've just started the YouTube channel more recently. So it's a smaller number of years. But up to the middle of August there were about over 300,000 views and 2,100 subscribers. And I mentioned the 819 videos there. But in terms of evidence of impact of training, I'll give you, there are a variety of papers, as I mentioned earlier, but this is one that I think illustrates the point reasonably well. And this is a study I was involved with that had 852 manual wheelchair users in Kenya and the Philippines. And in recruiting participants, the aim was to have about half of the participants who had received some of the WHO services. At that time, it was the 8 services, which we got more granular and boiled it down to 13, actually. So half of them had received services as part of getting their chair, and half had not. They'd just gone to a local healthcare store and bought a chair, and away they went. So I know this is a busy slide. I apologize for that. I'm not going to go into the details, but these are the 13 services we broke the 8 WHO steps down into. And at the bottom, we've got a composite service score ranging from 0 to 13. And across the top here, we have 4 important outcomes: daily wheelchair use, outdoor unassisted wheelchair use, high performance of ADLs, and absence of serious falls. And over here, we have sort of a composite of the ones in that direction. So if you go over to this column here and you look down there, so there were some of those services that there was no apparent effect at all from those services, and others that seemed to have a pretty good effect. The one that had the greatest effect here, you trace that back over, that the provider did training. So that's some indirect evidence of, well, overall, the WHO service steps helped with the overall impact. But if you got more granular, you found that the training was the one that had the greatest impact. Okay. So I think I've taken you through some of the steps involved since 1996. It's the program it began very simply and has continued to evolve and refine itself. I wouldn't say we're farther than about here in terms of this graphic shown. There's certainly a great deal of further evidence that's needed about individual skills and about which types of wheelchair users benefit the most and specifics related to diagnoses, for instance. But it already seems to work very well and has much evidence of safety and effectiveness as many of the things we do in rehabilitation. So we feel confident that in recommending it to you, and obviously the World Health Organization is recommending it as well. As Voltaire said, the perfect is the enemy of the good. No, the wheelchair skills program is far from perfect, but it's not bad, and so I think it's worth implementing. So having said that, we decided to look at, did a couple of surveys, one just here in Canada, in Nova Scotia, but then we followed that one up with this one, which is a more global scale one. And we ended up with 309 responses from wheelchair service providers in 35 countries. And although a fair proportion of wheelchair service providers said that they did training, if you look down at the amount of training that was given for clients or caregivers, there really was very little. And so that's disappointing at this stage in the game. Having said that, when you're implementing anything that's relatively new, as wheelchair skills training it's only about 20 years old, from the standpoint of taking our approach to it, at least, there's these couple of valleys, the so-called death valleys, and I think we're past this one and we're into this valley here. And what we need now are people to actually start using it and helping us refine it in their use. So coming back to objective number 3, how these training protocols might be implemented in your own settings. If you go back to the website and click on here on courses, you can see we do offer a variety of things like the webinar we're giving today, for instance, as well as practical in-person workshops in various locations where we're planning on submitting 1 or 2 such workshop proposals to the RESNA meeting in Chicago next year in May. That deadline for submission is the next couple of weeks, and that's our intention, is to submit there. But we also will travel to places on invitation that people will pay our expenses and make a little contribution to our Wheelchair Skills Program Trust Fund. We're happy to have skills will travel. But having said that, oopsie daisy, you can look a little farther down. It is possible to do a series of self-study, basically, and remote training using the manual, the YouTube channel, and so forth. You can send video of a client or of yourself doing a video, doing a wheelchair skill, and we'd be happy to provide feedback on it. We've published a couple of papers on that sort of thing, with the University of Pittsburgh taking the lead on that process. And we've got another one in the data collection phase as well with this video feedback service. So also there's a certification exam which you can take with no preparation. Just go on there and take it. It's free. But if you want to get a certificate, and we get a certificate of successful completion of that exam. But if you want to do self-study and keep a log of your self-study activities and submit it to us with evidence that you passed the exam, we're happy to provide a certificate like that. Here's what the log looks like. So you just basically keep track of the date, what self-study activity was, number of hours involved, total them up. You attest that you did this work, and if you have an instructor, which is optional, they can sign off on it as well. So you send that in and evidence of passing the exam. The exam is shown here. You just go in there and away you go. And if you pass, it generates a certificate. If you don't pass, it doesn't. There's a learning exam on the website that you can try that first to see whether what your chances of passing it are. But you can take it as many times as you like, and it's free, so there's no barrier. And this is just basically the certificate that we would grant, with your name, the self-study totaling whatever number of hours, the dates of the self-study, the date of success on the exam, and that's the end of that. So in addition to the Wheelchair Skills Program opportunities for learning, certainly recommend the learning opportunities available through RESNA. The ATP process, for instance, has been around for a long time and is very highly regarded around the world, and I commend that to you. Also, the International Society of Wheelchair Professionals has got some certification process now, and again, educational materials that if you're not familiar with the ISWP, there's their website there. So I'll end where we started, which is with the session objectives. I think I've told you a little bit about the WHO wheelchair service delivery process, 4 steps. Basically, select, fit, train, and follow up. The components of the Wheelchair Skills Program, which are the Wheelchair Skills Test, and the Wheelchair Skills Training Program, extent of research evidence, lots, and how the WSP assessment and training protocols can be implemented. Just start using them. You can get certified if you like, but there's no need to do that. There's no fee to use any of the materials online. The only requirement that we would ask is if you're going to use it, if you're going to download the test of the training program and use it with your clients or research projects, just as long as you acknowledge your source, we're quite happy with that. So I'm going to stop sharing there, and be happy to take any questions. If you want to turn on your cameras or your mics, please feel free.
So I have one question that was sent to me. Are the wheelchair provision guidelines for the World Health Organization only relevant for wheelchair users of manual wheelchairs?
No, they're for wheelchair users and caregivers of any kind of device, manual wheelchairs, power chairs, or scooters. I can't see if anybody's got their hand up at all, or if there's anything in the chat window, Mariah.
Yeah, so I have another question. If I want to begin using the wheelchair skills program in my rehab center, are there any fees to use the materials or other restrictions?
No, none whatsoever. Just you're just free to go ahead and use them.
Feel free to put any questions that you may have in the chat, or you can unmute yourself and ask any questions.
Hi, my name's Clint.
Hi, Clint.
Question regarding not so much what this material is, but do you have other webinars regarding more specialty controls where around diagnoses and the types of specialty controls available?
No, I don't have anything related to that. It's really just focusing on how to do the skills and how to assess them and how to do them. Yeah.
Okay, thank you.
There is a little bit of information there, but we certainly acknowledge the importance of such things, not only of wheelchair components, such as a power assist and what that might do for you, but also the importance of programming to get it right. You may not be able to get over an obstacle with one set of programs, but you can program in more torque to get the chair over. We've got in the YouTube channel, we've got quite a number of videos of people in power chairs doing skills with some with mid-wheel, front wheel, and rear wheel drive. So some of those you might find useful.
I'll look into that. Thank you.
You're welcome.
So we do have some questions in the chat. Our first question is, how are the WHO guidelines from 2023 different from the RESNA service provision guidelines, which have not been as recently updated?
Yeah, the RESNA guidelines sort of followed basically the WHO ones for 2008. They're very similar, and so I would tend to go with the more recent ones because there was an evidence-based process at that point.
And we have another question. Can this be used with the pediatric population?
Absolutely. As it's said earlier, it's sort of any wheelchair user. In fact, we've got the number. If you go on the website, there's even a separate section called Pediatric Resources, where we put up some training books and there's pediatric videos as well there.
And we have one more question. Could we get the direct website for the materials one more time? Thank you.
Sure. For the wheelchair skills program, it would be www.wheelchairskillsprogram.ca.
And I'll go ahead and put that in the chat. It's www.wheelchairskillsprogram.ca.
It's in one of the slides that will be coming to you in a handout format.
Perfect.
So I see we've got a bit of time, and so if you don't mind, if you'd like to, maybe we can. I'll see if this works a little bit better than it did earlier. Let's see here. Can you see that now? So these are some series of 8 quiz questions that we gave to our rehab medicine residents last week. They were kind of fun. I thought maybe I'd run them by you folks and just let you see some of the thought processes involved, unless there's another question that would supersede that.
We do have another question.
Okay, go ahead.
What is the website where the online courses discussed can be found?
Yeah, if you go to that one, that's the overall website, and you look in the menu on the left side, and it shows one of the options is courses. Well, let's just tackle a few of these and see if it generates any other questions. So this is the young lady you saw trying to get through the gravel earlier, and she's now demonstrating how she relieves weight from her buttocks. So let's just see what.
So you lift your bottom off your seat, hold off the glass and come down. That's pretty.
So the comments there that we were expecting from the residents were, is standing up permitted as a weight shift? Yes, the answer is yes. What sort of a wheelchair skills test score would she get? Well, she's safe because she didn't tip the chair over, although she's at risk of it. And it would be effective if she kept it for long enough. But for the wheelchair skills test, we require that they do it for 15 seconds. Now, however, you could say that's a testing error on the part of the tester, because what the tester is supposed to say, maintain that weight relief until I tell you to go back to your usual sitting position. So it could be either level 2 or a testing error. But the room for improvement there would be, we would rather, of course, that she weight shifts by leaning to the left or right or forward to unweight her ischial tuberosities. And the other training tip here is you can see if you are going to be leaning forward, or in worst case scenario, standing up like she did, then your casters should be trailing forward, not backwards, as is illustrated here. So this brief video illustrates a number of interesting points related to the skills testing and training.
So you lift your,
So in this one, I'll let you see it. So a couple of points here. We were looking for diagnosis from the residents, and this gentleman is able to use his legs quite effectively, but not his arms. And that pattern is commonly seen as in his case with central cord syndrome, that affects the arms and not the legs. As far as a wheelchair skills test score, we don't use the gravel anymore. We use a gym mat. They're a lot easier to come by and less noisy. And less displaceable. The gravel is something you might practice outdoors, but it's hard to maintain. It gets quite dirty. As far as corrections, so he was safe, he was effective, so he would get at least a wheelchair skills test score of 2. But what corrections would you recommend? Well, the 2 that we were looking for here was his seat height is too high. He wasn't getting, with any foot propulsion, your seat height should be slightly lower, 1 to 2 inches lower than your leg length from the back of your knee to the bottom of your shod foot. And the second thing, he's wearing Crocs there, and he should have better footwear on to be able to keep them in place during it. So those would be the couple of wheelchair and clothing recommendations, but his technique as such is fine. So there was no training recommendations coming out of that. So this is a training exercise done with a young man. Somebody asked about pediatrics, so here's an example of a young man with spinal cord injury.
okay, yeah, I think you're gonna do probably the whole time. We're happy there. And not there.
So what is the purpose of the training exercise? Well, there's never a functional reason to do a 360, almost other than dancing, perhaps, to do a 360, whether it's on a slope or on level, or if there are ones I can't think of any offhand. So the purpose of doing this during training is to just help build his confidence and skill in handling his chair and in the wheelie position on an incline. That's one of the WST skills, is descending a steep incline in the wheelie position. So this is just fun and building confidence. There's no functional purpose other than that.
Okay,
Now this man has left hemiplegia and right transtibial amputation. And so we asked the question before we showed the video to the residents, would they expect the person to be able to get up a high curb? And then we said, let's look at how he does. Water does a good job of sort of changing position. So the answer to A is, of course, it's fairly unusual to be able to do this, but it's certainly more people can do it if you give them a chance than you might think. Usually not a high curb, but a lower curb or an obstacle. And the backward direction when you encounter rolling resistance is well documented in literature to be the preferred way to go about it. As far as the WST score, well, he was safe. He didn't fall. The spotter didn't have to intervene, although she looked as though she would have liked to. And he was effective. He got up the curb and back in the chair, so he would have got at least a 2. But probably as far as commenting on his technique, I think he was close to being able to stay in his chair if he could just have backed those casters up just a little bit further. He would have been wouldn't have had to get out of the chair. And getting out of the chair is not a problem as far as the wheelchair skills test. Whenever faced with decisions about to allow something or not, we all say, well, what's the real world situation? In the real world, would somebody to get out of their chair? Yeah, they would. So why would we prevent it in our wheelchair skills program? Yeah, that's question number 4. So we asked about this gentleman getting up a high curb, a different approach. So is this the usually recommended technique? No. The usual technique that we teach is for people to take a moving approach, pop their wheelie at their casters at the last moment, land the casters before the rear wheels hit, so that when the rear wheels hit, the momentum plus leaning forward will bring the rear wheels up. However, that for a high curve, that can be a little anxiety provoking, and even though it's only unsuccessful for a good user infrequently, when it is unsuccessful, it's fairly catastrophic. You shear off your casters or you fall out of the chair forward. So if you're able to do what this wheelchair athlete is able to do, which is I'll show it to you again, which is he gets his casters up, then he moves his weight to the front of the chair. There's no risk of him tipping forward by doing so. And then he just does a little bit of a bunny hop up the slope, up the curb. So safe, effective. Any room for improvement? No. So it's a wheelchair skills test score of 3. Now this is interesting. This is somebody coming down a curb backwards. So lots to say about this. First of all, if the tester or trainer sees that somebody is about to do something that they have a pretty high likelihood of it being unsafe, should stop it, should intervene and say, okay, that method is not acceptable. What you're doing, you got to fail on it, because the spotter had to intervene. Should not have let her go ahead and do it. Secondly, the spotter should not have just had the spotter strap, because if one wheel drops off before the other, as is not uncommon, then the spotter strap is no good for preventing lateral tips. So the recommendations on spotting in the manual are that you have your hands near the push handles as well as your hand holding the spotter strap. So it's the spotter difference. So in terms of what differences in terms of technique that the wheelchair user should have used, she should have been leaning, if she was going to do it in the backwards direction, which is quite safe and effective, she would lean forward so her trunk was right on her knees, and then keep moving as she landed, and not come to a sudden stop, which produces the rear tip. Now this is about descending stairs, and is this the usually recommended technique? We showed coming down forward in the wheelie, which is acceptable, as we mentioned earlier. And the answer to this is yes, this is, if there's a rail available, hold on to it with one or both hands. However, if we were to give him a score on that, it would only be a 2. And the reason is not that he was unsafe for himself, he was unsafe for anybody, perhaps somebody with poor visual acuity approaching the stairs from below, because as I'll show it again, he did a bit of a shoulder check to the left, but did no shoulder check to the right, or not an adequate one. Right there, that's not adequate. So that would be a 2, and it's just be more careful to other people, Well, you wouldn't say it, not tone of voice, obviously, because this guy's highly skilled. This is how he gets down to a subway platform when going to work in the morning. So this is the same person coming down some stairs in a different way. This is the final video. So the first question is this an acceptable technique for descending stairs? Yes, it is. Not in the wheelchair skills test because we could not safely spot them. And so anything that might endanger either the learner or the subject or the test personnel or trainer, we just don't allow during the wheelchair skills program activities. Not to say that if somebody wanted to learn this, they couldn't, but and it's an acceptable technique. We're just not prepared to test it or train it. So if someone said they wanted to do it this way, I would say, well, we're not comfortable with that. Do you have any other methods? And if you turn around and come down backwards, holding onto the rail, that would have been fine, or come down forward one step at a time in the wheelie position, that's fine. As far as spotting for this particular technique, this gentleman, who's a peer trainer himself, and as I mentioned, very skilled, developed a pad that fit between the rear wheels and went right up behind his head, so that when he was learning this, if he fell backwards, he would land on the pad. Of course, forward tipping is also a concern, and one can envision things such as an overhead harness in some circumstances where you might be able to train this and be able to catch the person if they're going forward. As far as the key training tip, I'll play it again. You'll notice that this is not a complete wheelie. This is a transient tip, just as you would use for getting up a curb or over an obstacle. So the key training tip is for him to pop the casters just as they reach the top step, so that they're off the ground as he comes down on his rear wheels. So I'll show it to you again. Okay. I'll stop sharing that. I don't know if those videos generated any further questions or comments. Welcome. No, we're kind of running out of time, but be very happy to hear from anybody.
We do one question. Do you recommend this program for users with degenerative disorders such as cerebral palsy or Duchenne's?
Yes, absolutely. In fact, we have headed by the principal investigator, Krista Best out of Laval University. We just got $100,000 Canadian dollars to study exactly that, this training program for people with muscular dystrophy and one of the variants as well. It's just getting started with the data collection phase. Anybody else?
Any more questions? Feel free to put them in the chat or unmute yourself.
Or email me afterwards. I'm very happy to hear from you. Kirby@dal.ca. Thank you so much for your attention, and I really appreciate the opportunity to present this to you.
All right. Well, thank you so much for taking the time to present this afternoon, and thank you to everyone who joined us. As a reminder, the recording and slide deck will be available on RESNA Learn within 2 business days after this webinar, and the CEU post-event assessment and survey are now available on RESNA Learn. If you have any additional comments or about the webinar or want any information, please email the RESNA staff at info@resna.org. Thank you for joining us, and this concludes today's presentation. Thank you.
Thank you. Bye for now.